Assalamualaikum warahmatullahi wabarakatuh. In this presentation, I'll try to explain the program of community development that been done by my team, and the title of the program is Improving Maternal Parenting Knowledge to Prevent Stunting in Guwosari Village, Pajangan, Bantul. And first, I want to introduce the team that doing this program. First, myself is the team leader, Cahyo Ramadhan, and then my member there are Dr. Ahmad Hermawan and also my student Krido Ambardi Kunaifi. Us came from the Islamic Communication and Broadcasting Department, Faculty of Islamic Studies, Universitas Muhammadiyah Yogyakarta. And then there are collaborator from outside of our university, Mr. Ferry Julianto, that came from Department of Psychology, Faculty of Social Humaniora, Islamic State University, Sunan Kalijaga, Yogyakarta. And the background of the program that we done here is about the child growth. So the child is our future, our nation's future, and the delay or the problem in the development of our children will become our problem. So we have to pay attention about the development of our children. One problem that happen in the development of our children is stunting. That stunting is the condition where the child height below minus 2 SD, standard deviation from HAO standard. It may indicate chronic malnutrition and affect multiple areas of development. And the stunting prevalence is in Bantul Regency is outside the boundary of average prevalence according to HAO at 2023. It become better in 2024, which is the prevalence is 16.5%, but it's considered moderate by standard of HAO, but still it is above the national target, which is 14% of the prevalence. So stunting still become problem in Bantul Regency, and it need to be thought about. It needs to be our attention, including in some region in Bantul area, which is Guwosari village, that become the place of our program. So the opportunity here, actually the government, Bantul government and also Indonesian government and also Guwosari village government done several attempts, several programs to overcome the problem of stunting, and the result is promising. We can see that there is development in the condition of stunting. It become better, from the last year. But we as part of community also can help the government effort to uphold the condition of development of our children. So we can do community empowerment, community development program in Guwosari village. And one way to improve the condition of child development in Guwosari village is to improve communication for behavior change by increasing mother knowledge about parenting. As not in 2023 Indonesian Health Survey and also in the 2024 Indonesian Nutritional Status Survey, knowledge is a risk factor for stunting. So when we want to overcome the problem of stunting, we have to overcome the problem of knowledge in the mother. Therefore, we conduct a program on improving maternal parenting knowledge to prevent stunting in Guwosari village, Pajangan, Bantul. So the method of our program is doing community discussion, which is planning with local leaders and residents. Actually, we have a plan, but we want to include the local leaders and also the residents, so they feel becoming included in our program, because the participation of the community is very important in the program of community development. And then there are parenting education. This is about parenting, so we transfer knowledge about parenting and also about child nutrition and also also the understanding of the stunting and also the risk of stunting. So the parents, especially mothers, become more aware about the effect of stunting and eager to overcome the problem of stunting in their child. And also after education, after transferring knowledge, we open the discussion. So it is basically question and answer session, and also sharing experiences between the participant, and also sharing experiences from the our expert. And the last one is evaluation. We do survey and also interview and also observation to collect the data to know more the effect of our program on the society. So the public discussion with the Watuguduk community was held on February at the home of the Pak Duku, or the leader of the hamlet. The activity was attended by 5 residents, and also it held in the Santan community on March, and it is also done at the home of some resident of the hamlet and attended by the 20 residents. And then the education also held in both of Watuguduk hamlet and also Santan hamlet, and each attended by 20 participants, and all the participants are female residents of each hamlet. And before the educational activity carried out in the 2 hamlets on the same day as the education, an assessment was carried out to know more, to assess the condition of the knowledge of mothers about the parenting and also the stunting. The average score of participant was 6 out of total score of 10. And after the educational activity, we held a discussion, and participant appeared enthusiastic in listening the explanation in education, and also asking and answering question in discussion. So we see participant seems quite enthusiastic. The evaluation activity was conducted by distributing instrument, that is survey, to measure mother knowledge level regarding the parenting and stunting condition, and also we do also interview with several participants. The evaluation was conducted on June in the home of Duku Watuguduk, or the leader of the hamlet, and it is attended by 3 hamlet residents, and also it is done in hamlet Santan and attended by 5 hamlet residents. And not all the participants present at the time of the evaluation, so we left the instrument, the survey, with residents who were present, and we collect the instrument in the following day. And also we conduct unstructured interviews with residents who attend the evaluation, and we ask them more regarding the perceived impact of the our program on them. In general, participants did not feel a significant change in their daily life, but they said when they heard the word parenting or caregiving, what came to mind was not only the activity of educating, but also providing food for the children. So they build the connection between food, nutrition, and also the parenting. This is very important because stunting related to the malnutrition. So the food is very important in the parenting. This could indicate the change in knowledge, in perception. This change was also shown by the result of the collected instrument, the survey, and the participant score the average participant score become more higher than before the education, and the score reached 8.7. So we can consider our program successful because it is held smoothly, and also we see several changes in the knowledge and also the perception of the participant. This is some pictures, documentation of our program, and that's all our presentation. Thank you very much, and wassalamualaikum warahmatullahi wabarakatuh.